What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for any other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, February 18th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, it's been a rough winter. A ton of people have been sick this winter. COVID, flu, norovirus. All kinds of different viruses have just been running through the roof this year, and some viruses from the past that we thought we had contained, yeah, they're starting to spread out of control as well. I'm sure you see the headline that's here. You need to be informed with what's going on with all these viruses. And the best way to do that, subscribe to my channel down below. I give you comprehensive updates each and every day of what's going on with the latest news, data, and everything else in between. So subscribe if you're new down below. Help me try and get to 10,000 subscribers this year. Hey, we're almost at 7,000. I think we can hit 7,000 by the end of this week. Of course, give this video a thumbs up. If you like the update, try for 200 likes today. Share this video with anyone you know. Leave your comments down below, and don't forget to hit that notification bell. It is supposed to notify you of my latest updates. All right, we do have several news stories for today. We also have some data to talk about, and yes, we're going to take a look at some more Walgreens as well. I don't know if we'll get to any wastewater today because I do want to take a look at a few more of those states for hospital capacity. I have one loaded up there. Wait till you see it. There's one state. I'm not going to give away which state it is till the time comes, but wait till you see. They're using a large percentage of their hospital beds right now. Not a good thing. We're trying to keep this at a 20 to 21 minute video today. Let's see if we can do that. All right, starting off in Texas. This is quickly spreading out of control. Measles outbreak update. 58 cases reported across the South Plains. It was 48 back on Friday. It was 20-something before that. It started out with 1, then 1 became 2, 4. It's just rapidly multiplying. This is not a good thing whatsoever, and according to the, looks like Department of Health in the state of Texas, 13 patients have been hospitalized now with this. So, yeah, this is not going well whatsoever. We don't see any deaths yet from this outbreak, and I hope it stays that way, but at the rate it's growing, and the fact that they're saying many people could be infected, in other words, meaning more cases to come, knock on wood, hopefully we do not see any deaths from this. I mean, this is a real problem. We're seeing a lot of past viruses start to come back and come back with a vengeance. We've been seeing more measles cases in many different places. Whooping cough's been going up. We've been seeing other viruses come back. Yeah, this is a problem, and it's a problem we need to figure out fast. Heck, flu, which is something we see every year. Flu is higher than we've seen in such a long time here in the United States. And really, the writing was on the wall early on that flu was going to be bad because the UK got hit really hard with flu at the end of last year. Speaking of the UK, parents warned as measles cases are rising there as well. And it looks like in the Bristol section, 25 cases. It has reached almost half the number of all of 2024 already. And what are we? We're only at February 18th. Yeah, this is not good what's going on here. Yeah, I'm really concerned about a lot of things. Here's something else I'm concerned about. Minnesota will start testing raw cow milk for H5N1 bird flu. Good thing. I'm concerned at what they may find. I'm hoping they don't find a ton of H5N1, but it is possible that that happens. Moving on, flu. Surge in flu. COVID cases impact North Carolina schools and daycares. Yeah, there's been a lot of impacts to schools, not just there, in states all around the United States. It has been a big issue. I have the school illness tracking thread. I never actually did complete them all. I'm probably still missing about 10 schools. But you know what? There's so many schools in there right now. It's crazy how bad it is across the United States. But take a look at this. Health officials report at least 171 flu-related deaths so far this season in North Carolina alone. 2 children reportedly died from the flu in North Carolina this season. The state health department reported on February 12th. Yeah, That's an issue that it's like the issue that just keeps on going. Allegheny County, this is in Pennsylvania, reports the most emergency room flu visits since 2022. Ooh, this is not good. And 2022 was a bad flu season. According to the Allegheny County Health Department data, there were 830 emergency department visits for flu in the week of February 2nd, the most since November of 2022. It would be understandable that the number would be really high in November. We're in February now, and I showed you yesterday on the national map from the CDC. If you did not see it, go back to yesterday's video. I showed you the national map. I compared right now to what was happening last year at this time. And we are way worse than we were last year at this time. We should probably go back and look where 2022 was at this point. Well, 2023, because 2022 into 2023, that was a bad year as well, but this year is worse. Yeah. All right, chronic wasting disease hits second Wyoming elk feeding ground in a previously unaffected hunt area. Yeah, chronic wasting disease continues to spread into more and more areas in the Upper Green River elk herd, and the second time the disease has been found on a state elk feeding ground. Yeah, that's not good. This is Hunt Area 87, as they call it there. Here in Pennsylvania, my state, we call it state game lands. Maybe number 1, number 2. There's a lot of different state game lands. Like our place upstate is right next to state game lands property. So, yeah, each state does that differently. And chronic wasting, I'm really concerned about that. But I've said this before, and I'll say it again. I'm concerned that the moment comes. I don't know when it's going to be. Not chronic wasting disease, but bird flu. I'm concerned that eventually bird flu gets into the deer population. And if that goes deer to deer, number 1, that would be really bad for the deer. Number 2, hunting, people having interaction with deer, people harvesting the deer, that could be really bad. That's one of the, I think that could be a silent way bird flu ends up spreading at some point. I'm really concerned about that. I know it sounds like a conspiracy theory. Think about it. There's a lot of hunters in this country. Pennsylvania alone sells over 800,000 different hunting licenses. And it's not just deer. There's several different things that you can hunt for in Pennsylvania. Suppose hunters start coming in contact with H5N1 while hunting. Think about that. That would be really bad. Alrighty, in Vermont, COVID fatalities in Vermont are up, but lower than last year. This is some good news. Fatalities, I mean, we're seeing this in a lot of states where fatalities are lower than previous years. The number of reported COVID cases in the most recent update went from 189 to 162. There were 67 in just early December. So you can see their numbers are higher right now. The pandemic death total in Vermont stands at 1,258 deaths as of February 8th, 2025. The most recent data available of the 6 reported deaths last week, 4 were of people over 69. So there you go. The biggest population of, get this, of total deaths to date, 1,013 have been of Vermonters 70 years of age or older. But again, you can see under 70 years old can die of COVID because their total death number is 1,258. I remember when Vermont used to be one of the best states to handle the COVID pandemic. And I don't know if that's actually can say that is still the case. All right, take a look at this. This is from EpiTrend. And we're going to take a look at some wastewater data here from some other countries. I often get questions saying, can I do this country or that country? I can only do whatever country or even state in the United States that I can find data for. Austria, we can see things were dropping now. It's starting to stall off a little bit. Slovenia is dropping. France at this time is dropping. United States not shown here. Sweden, overall, Sweden has been rising. They've been seeing a more typical winter wave, kind of like what we've been seeing here in the United States. It peaked and then it went up again. But their second go-around of going up was much bigger than the United States. Switzerland hasn't updated since October. The Netherlands at this time looks like they have leveled off a little bit. Maybe they're going to start going up. New Zealand, which we'll take a look at New Zealand in a moment. New Zealand is overall holding flat, maybe rising just a little bit. Italy at this time, it looks like the hospitalizations with symptoms, that's holding steady or maybe even rising just a hair. Positive cases, at the very end it went up a little bit, but overall it's not rising. taking a look at what's going on in Finland. Finland's dropping. Germany is dropping. Canada, wastewater. Take a look at this. Wastewater for Canada is rising at this time, and Berlin did not update. So some of this was wastewater, some of it is actual cases. You get the idea. We saw some international countries here. Most of them are not doing bad at this time. All right, New Zealand. Here's what's going on there. The average, new case average, 83, and rats average, or uploaded average is 186. You do see an up arrow, so that means I think their average is starting to rise a little bit. Cases in the hospital as of Sunday night was 65. Deaths attributed to COVID. It looks like maybe they added another 11 on the 7-day average. I think they might have added another 11. But then you come down here. It says outcomes since the first New Zealand case. And it says change in the last week. Recovered. 677. Recovery is a good thing. Deceased. 6. So that would be the number of deaths. 6. They've added another 6 deaths. All right, moving on to this. I showed you Mike Horger's latest update yesterday. Now I'm going to show you Jelly Roll Blues in his update. And this is his MAPS ensemble forecast. So let me tell you something. I also am a hobbyist when it comes to weather. We take computer models, and sometimes with those computer models, they get ran many more times. And with that, you come up with an ensemble, and you come up with a mean. Same is done here that he does with COVID modeling. So he takes an ensemble forecast, and he comes up with, I believe, ensemble forecast for USA 1 to 30. So through 5-30. Those are dates, and it looks like there's maybe 20 different members of his ensemble. So we see we have the high road, we have the middle mean, and then we have the lower outcome. And with the mean, what we do see here is, or with all of them, we do see his model suggests that come time we get into March, it looks like things may start going up again. And there's reason to believe this is possible. Not saying it's likely, it's possible. Why is it possible? Because we are watching the LP 8.1 variant. So we'll have to see what that variant does. According to his modeling, looks like it may cause things to go back up again. So something interesting. Thought I would share this with you. Just another potential outlook of what could happen in the future. You know, people are trying to schedule doctor's appointments and many different things to help keep it safe. You know, people like to schedule their appointments in between waves. And according to this, the rest of this month, we are in between waves. Now, I know it's a little late to schedule an appointment, but think about it. If you have to do a little something that's maybe a little more high risky, at least when it comes to COVID, we know flu is very high all across the country. COVID standpoint, we're coming into a little bit of a down period right now, at least according to his modeling. All right, taking a look at this, my website, datareport.info, you can find all kinds of information there. In Canada, COVID viral activity level is moderate, flu A is high, flu B is moderate, RSV is high. Again, I did not see an update to this today. Taking a look at what's going on in Pinellas County, Florida. We got a few calls going on, sick persons showing up a few times, and a few other things are showing up as well. Taking a look at what is going on with air qualities, and what you will probably not see here is there is a little plume of bad air quality, or was, just outside of Philadelphia. We had a really bad fire about 5 miles away from me last night. I'm really bad. One of the worst fires ever seen in Montgomery County, Pennsylvania history. A place that manufactures aerospace parts. Yeah, the machine shop. Yeah, it's a big place. It went up in flames last night, and it actually reignited again about 10:45 this morning for about an hour. It's back under control again. We're just seeing a few yellow areas, a few orange areas across the country, some red. Generally not terrible. We have seen this map look worse before. Let's see what Philadelphia reported for today's EMS volume, or for the Sunday. Did they not report today's EMS? Okay, apologies. Looks like there is nothing from what's going on there. And they even mentioned the city is monitoring a large fire in Montgomery County and has assets and, test air and water quality. Yep, it is a real concern. Hopefully they get this figured out really quickly, because I got a feeling there's going to be lingering problems. Majority of these disasters have lingering health effects. Take a look at this. Montgomery County, Pennsylvania. I've been noting this for a couple days now. I think we're starting to slow down. And there's some data in Pennsylvania that suggests this as well. EMS calls, yeah, there's 15, but not the really high numbers we've been seeing a few weeks ago. Still busy in Chester County. Earlier, I'm telling you, it was not this busy in Chester County. I'm seeing 1, 2, 3 respiratory calls. Also seeing 3 sick person. I think yep, 3 sick person calls as well. Something to keep an eye on. All right, taking a look at what's going on with the hospitals. Yeah, still seeing a lot of hospitals with issues in Pennsylvania. New Jersey still has some hospitals with patient volume issues as well. Even Jefferson Cherry Hill Hospital, yeah, that's emergency department divert you are seeing there. Taking a look at what's going on with flu in Pennsylvania. Very good news. It looks like flu has once again peaked. We hope it stays dropping this time. We don't want to see another drop and then back up again. We can only hope. This is some really good news. Flu cases this week are at flu A, 22,135, still a high number. Flu B did go up a little bit, 771 cases, and RSV, 2,228 cases reported this week. But flu A, once again, has peaked in Pennsylvania, so that is a really intriguing sign. RSV trends, we can see here that there are 38,009 laboratory confirmed cases between 29th of September and the 15th of February, 348 influenza deaths this virus season, and 793 COVID deaths this virus season as well. All right, taking a look at Walgreens, we're just going to look at the national rate here, 10.9% COVID positivity rate, and we will do just a couple states. Nebraska, 3.5%. North Carolina, the positivity rate is 13.5%. Kentucky, the positivity rate is 13.6%. Missouri, 12% positivity rate. Maryland is at a 7.9% positivity rate. Oregon, 6.7% positivity rate. Washington State is at 11.9%. California, the COVID positivity rate is 10.9% at this time. All right, in Chicago, we do have something interesting going on here, and this did update. Influenza emergency department visits dropping. Influenza positivity rate 20.4%. Influenza A activity is running high. RSV is still running high. RSV positivity rate is at 3.9%. And let's see here. RSV emergency department visits are low. That's holding steady. So everything dropping there. But then we come to COVID. COVID, emergency department visits low and holding steady. But the positivity rate for COVID, there is a red up arrow. So that means it's going up. It's at 5%. You can see here it's just a small rise. And the COVID activity level is moderate. And throughout January, it did see a little bit of an increase. So we'll have to keep our eyes on that. In Virginia, COVID-19 emergency department visits are stable. Influenza is still 9.6% of all emergency department visits and trending down. RSV is stable. And overall, respiratory activity in Virginia is high, but trending downward at this time. In Houston, Texas, some good news there. We're seeing more flat wastewater sites, and we're seeing more dropping wastewater sites. That is a good thing. I hope to see more in the way of dropping start to pop up on this map relatively soon. All right, skipping over wastewater for today because I did want to show you this. In Maine, hospital inpatient bed occupancy. Yeah, they're using a lot of bed capacity. 85.4% of all beds are being used in the state of Maine right now. That's really bad. That's as of Saturday, February 8th, so that may have updated since then. It is lagged. I mean, we're here at the 18th, but again, that's not a good number. ICU capacity's been trending upward, but that is only at 64.1% of usage in the state of Maine. And let's go somewhere else. How about we go out west somewhere? How about we go to Utah? Let's see what's going on there. In Utah at this time, they're using 67.9% of beds. That's not bad. How about the ICU usage in Utah? Let's see what that is doing. We can see ICU usage there is at 67%. And let's see, where else did I want to go? Can we do Puerto Rico? I don't know. Okay, we can. Wow. At one point, Puerto Rico was 76.2% of bed usage. That went down to 54.8%. That actually got better. And let's do Puerto Rico for the ICU situation. And ICU situation there, 73% of ICU beds are being used at this time. And I want to do one more place in the United States. Let's go out to Nevada, shall we? What's going on there? In Nevada, they are currently using 76.1% of all hospital beds. And in Nevada, when it comes to the ICU situation, pretty tame. 68.4%. We can see that's not really rising right now. It actually dropped a little bit. Well, now it actually held steady. So 68.4% of beds being used there. The latest COVID variant is XEC at 37%. And there it is, that LP 8.1, which we're going to have to keep our eyes on to see if it does anything. It's possible it may do nothing. It's at 31% of the cases right now. Remember, historically, we don't usually see a big spring wave. Sometimes certain areas do, like Florida sometimes does because, hey, spring break. So we'll keep our eyes on that. New York State added 705 new cases today. And taking a look at hospitalizations in New York State, 843. The new week of data will start tomorrow. It's a day delayed because of the holiday. All right, real quickly before I go, we got to do the hydration break. If you have not hydrated yourself, now is a good time to do that. Today's drink of choice is water, and water is a very good thing to drink. You can never drink enough water in a day. Be careful, you don't overhydrate yourself, but you really do want to make sure your body's getting enough water. Hey, that can cause a lot of problems. It can actually cause headaches. Now, we know that's not why I have headaches. Mine are post-COVID, but you get the point. Alrighty, folks, I hope you enjoyed this video. If you did, give it a like, give it a thumbs up. And if you want to see more content like this, well, heck, just subscribe down below. I would love to have you as a new subscriber. Share this video with anyone you know. Hit that notification bell and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.